Okay, so most likely cause or diagnosis. Okay, so you got a 40-year-old man, history of poorly controlled hypertension, acute onset of abdominal pain and bloody diarrhea, hypotensive, tachycardic. Despite fluid resuscitation, his renal function worsens. He develops oliguria and then diffuse cortical necrosis. Okay. So my gut reaction would be towards ATN. It is an acute issue. But let's see. I mean, he's got poorly controlled hypertension. Renal artery stenosis can lead to hypertension, but I don't know if that would necessarily cause his acute issue and his acute abdominal pain. Interstitial nephritis, I think, is more drug related, which doesn't sound like he's taking a drug that could cause that reaction. Um, Glomerulonephritis, again, would be some kind of reaction to a drug or some kind of antibody related complex. And ischemic colitis, I mean, with the oliguria, it sounds more like a renal issue than a GI issue. So yeah, I think I'd stay with the ATN.
Okay. So this is kind of interesting here. This doesn't actually like which of the following is the most likely cause of his renal pathology. Yeah, I have to fix this. This is not correct. But anyway, so it should be acute tubular necrosis. That's actually what's happening to the kidney, right? So we'll talk about everything here because this question is kind of interesting. So 40-year-old male, right? Like you said, poorly controlled hypertension, right? Which is never good, right? Severe abdominal pain and bloody diarrhea, right? So this is going to be called this is the diagnosis for his chief complaint, right? Ischemic
Okay.
colitis. Okay, so talk to me about ischemic colitis. What do you know about ischemic colitis?
So it'd be, I mean, just breaking down the words, it's lack of blood flow to the GI tract, to the,
Bingo.
yeah.
Yeah, it's like the way I talk about ischemic colitis is it's like a heart attack for your gut.
Mm-hmm.
Okay, that's practically right. Lack of blood supply, gut starts dying, not good, right? And
Mm-hmm.
then, right, then they say, he's hypotensive, tachycardic on exam, right? Because he's super, super sick, right? Because now, he's sloughing off a lot of his intestines that's dying, right? And he's bleeding, right? And then his kidney function worsens. Why do you think his kidney functions worsen?
Because he's not getting enough blood supply to his kidneys.
Bingo. That's the main thing, right? And then you develop
Mhm.
oliguria, diffuse cortical necrosis, which of the following condition is the most likely cause of his renal pathology.
The,
So
okay.
yeah, so the answer should be ATN, right? That's the most directly, so I'm going to fix that. But in theory, right, what cascaded all of this is actually ischemic colitis,
Yeah, that makes
right?
sense.
So that's kind of the thing, right? They don't really ask this kind of question too much because then you have to guess like which one you want them to. But let's go through the rest of them, right? So renal artery stenosis, right? You were saying that that can cause uncontrollable hypertension. Yes, that's true, right? But don't focus on kind of. I always say to my students, don't jump through too many steps. Okay,
Mm-hmm.
you want an answer choice that's directly answering what they're asking, right? So that's a little bit of test taking thing. So this can't be it, right? This has nothing to do with kind of anything that deals with this question. Interstitial nephritis, right? This is like an allergic reaction of the kidney. You're going to see a lot of eosinophils, right? It's usually people that take NSAIDs or diuretics or sulfa drugs, right? Not going to
Mm-hmm.
be an answer here. Glomerulonephritis, right? Things like infection and things like that, like post-strep glomerulonephritis, inflammation, right? You can see some blood in the urine, things like that. Not going to be your answer choice. So, kind of the chicken, the chicken or the egg here. So I'll probably fix this question because I don't like it. How it's kind of like you have to guess. Like, are they asking like, oh, what caused the ATN? Then the answer would be yes, ischemic colitis, which causes hypotension,
Mm-hmm.
which causes ATN. But then it's just like, yeah, they're asking like the renal pathology, right? What caused the necrosis? Well, in theory, is the
Yeah.
diagnosis of ATN, right? So I'll
Yep.
definitely fix this question. But yeah,
No, I
does that
mean, that
make
makes
sense?
sense because the ischemic colitis led to the ATN. So it's just asking either what is this ATN or what led to the ATN.
Yep, yep, yep. All right, perfect.